skincare, it can be simple. It should be simple. It doesn't need to be complicated. And when your skin is bright and vibrant, it makes everything look better. So that's usually where I start. Graceful aging, just trying to be the best version of yourself for as long as possible, but still yourself. And then
Dr. Mary Alice Mina is a Harvard-trained, double-board certified dermatologist and dermatologic surgeon with over 15 years of clinical experience. As the host of the Skin Real podcast, she offers real skincare guidance with a holistic and preventative approach. Co-owner of Baucom and Mina Derm Surgery in Atlanta, Georgia, Dr. Mina is recognized for her artistic eye and surgical skills, helping people feel good in their own skin through advanced surgical and cosmetic procedures. Dr. Mina, welcome to the show. So great to have you here today.
Oh, thank you so much for having me. I love, this is what I love about podcasts, right? I can talk to someone literally across the globe from me and we can have this conversation. So I think that's really cool. And thanks for having me.
It's my pleasure. I agree. If there was a message that you would like people to take away from this conversation, what might it be?
Yeah, well, if I could just pick one, I would say as a dermatologist, I would want people to know that skincare is really whole body care. It is so much more than just beauty care, aesthetics. It's so much more than just the stuff you put on your skin from the outside in. Really healthy skin, beautiful skin, it starts from the inside out. So it's really whole body care.
Excellent. And my audience loves holistic approaches to health, well-being, and so forth. So I know this will be of huge value to them. Perhaps you could share a little bit about your background and who you are.
Yes, absolutely. So I'm a double board certified dermatologist. I'm based in the US in Atlanta, Georgia, and I've been taking care of patients with skin concerns for over 12 years in practice. And my practice really is procedural dermatology. So I do a lot of skin cancer surgery, which is called Mohs surgery. But I also joke I'm like Dr. Pimple Popper ATL. I do cysts and lipomas. Those are a lot of fun, scar revisions. And then I also do aesthetic work as well. So the usual cosmetic things. Tend to have more of like a surgical procedural slant in my practice. And during COVID, I keep saying COVID was 2 years ago, right? But 4.5 years ago. But during COVID, I really got into podcasts and I'd never really listened to them before. And I wasn't going into my office seeing as many patients and I had a little more time on my hands. And I started thinking, especially as I turned 40 during COVID, and I started realizing like things were changing. My friends were asking me more questions about their skin and what's going on. And I thought there's so much misinformation out there and so many people thinking about skincare and their skin health, at least in my opinion, in the wrong way. They're going about it in the wrong way. They're getting frustrated. They're not sure what to do. They're overwhelmed. And I just felt like dermatologists really need to have the loudest voice in this space. And so I thought, it's great to see patients in my clinic, but it's difficult to get an appointment and insurance dictates how long they are and what we can do and what we can't do. So that's when I created the podcast about two years ago. And just to give people just good information about skincare, like your online dermatologist to help you just get some practical, unhyped skincare education for people. So I've been doing that in conjunction with my clinical practice for about 2 years now.
Excellent. And I've had a browse through the podcast. It's amazing. The link will be in the show notes for anyone who's interested. You can find it at theskinreal.com/podcast, if I'm correct.
Yeah, that's right. And I'll just spell real because in this day and age, real, with social media, but it's actually real as in real information, REAL.
Perfect. As you said, there is a lot of information out there with regards to skincare and skin health. Why is skin health more than what we put on our face?
Yeah, well, so I like to think of the skin as this window to what's going on internally. And I mean, I could list so many times where a patient has come in for something and they came in for this or I just happen to notice something going on internally with their bodies. and it's reflected in their skin. So
Mm.
I can sort of tell if someone is pre-diabetic or diabetic, or I can tell if they are having issues with their androgen levels based on things that I see.
This episode is brought to you by Start With Values. If you'd like to reduce stress and increase fulfillment in your work and life, then check out startwithvalues.com. There, you'll be able to download the Values app, which helps you to discover your core values and bring them to life through micro habits. There is a values course so that you can learn about the science and practice of core values, and you'll be able to pre-register for my forthcoming book called Start With Values. I hope that these tools will enable you to achieve more fulfillment and make more meaningful decisions on your journey of life. Now back to the episode.
I had a patient come in for something unrelated, and I just looked at his legs. He was wearing shorts, and one leg was really, really swollen and the other one was not. And I asked him, "Hey, how long have you noticed that?" And he's like, "Oh, yeah, I don't know. It's always been that way." And I'm like, "Well, your legs shouldn't be different sizes like that unless you have had surgery or something going on." And I sent him to go get an ultrasound, and he had a blood clot in his leg. So
Really?
that's what I love about the skin, is that you can look at it and just have all clues to the health of someone, or internal things that are going on that are manifested in your skin. So I think it's really cool. And I don't think people realize that, like your nails, they can reflect how your lungs are functioning, right? If you have these things called club nails. So all these things in your skin, your hair, your nails can reflect your inner health. And that's one of the things I love about dermatology. So yeah, it's important to take care of your body, because that again is going to be reflected in your skin.
Is skin health just about beauty and aesthetics?
Yeah, so absolutely not. And unfortunately, I feel like that's the message a lot of people get, and that leaves a lot of people out, right? I know I don't want to be totally like gender biased, but like for a lot of men, they're going to be like, okay, I don't care about aesthetics or wrinkles or whatever. So then skincare isn't for me. Or I could see this really affecting like boys or teenage boys or young men, right? Who might be like, I could care less about beauty. And so they don't really learn that they need to take care of their skin. And then they also don't know how to take care of their skin. And also, I don't know many guys who want to go buy like pink bottles and stuff that seems very girly, right? Like a lot of the beauty products are so geared towards, what they think women want. And that can turn off a lot of other consumers and buyers. So, yeah, I think that's a big misconception. And that's what I wanted to kind of combat on my social media platform and my podcast, that skin health really, it's for everyone. Now, yes, a lot of my patients are women, especially those who gravitate more towards the aesthetics, but I see aesthetics as like the last 10%, putting like the icing on the cake or the finishing touches on your skin. But really 80-90% goes on, in other ways rather than devices and things like that. So I really try to stress the importance of skincare being simple. But again, right, simple doesn't mean easy. It doesn't have to be complicated, and it doesn't have to be expensive. And I would say the three main things everyone needs is a gentle cleanser, a moisturizer, and sunscreen. And that's really it. If you really want to be super simple, and you can have amazing skin just by doing that. So you don't need to buy peptides and exosomes and all that. You don't need a 10-step routine, right? That's where I think
Mhm.
people run afoul, is like they're trying to do too many things, too many products. It seems like it's one or the other. They either do nothing or they do all these 10-step routines, and then neither of them are really getting the skin that they want.
Mm. And when would be the best time of day for someone? So say there's a man out there who's saying, I've never done this stuff before, but maybe I'd be interested. Is it in the evening or twice a day?
Well, so it really depends on your skin type. So if you tend to have really oily skin, you're probably going to want to wash your face in the morning and in the evening if you're acne prone. But if you've got really dry skin or normal skin, really, I have gotten away from washing my face in the morning, and I just splash it with water. So you don't have to wash your face in the morning, but I would say, or, depending on if you work at night, then you'll want to flip this, right? But I do recommend and really insist, wash your face at the end of your day, right? So
Okay.
for most people, right, in the evening, wash your face. You want to, especially if you're wearing makeup, you want to take that off. But even if you don't wear makeup, you want to wash your face. Think of all the stuff you've been exposed to, your skin's been exposed to during the day, right? Like pollution and just oil buildup, and your skin is always sloughing and turning over. So you've got dead skin cells that need to be wiped away and removed. So, wash your face in the evening. You can put on a moisturizer if, especially if you have dry skin. I feel like that's like the best time to put on the moisturizer before you go to bed. And then in the morning, you can either wash your face or splash it with water. And then in the summertime, I tend to still have pretty oily skin. So I actually don't use a moisturizer. I just use a sunscreen. But if you tend to have dry skin, then you're going to want to use a moisturizer and then put your sunscreen on.
Got it.
But I will
And
say,
for
like, sunscreen is where a lot of people forget and they don't wear it. And then they'll say, well, it's cloudy, or, well, it doesn't feel very hot out, right? Or I work inside all day, right? But then they forget they go for a walk, or they go sit outside for lunch. So I'm a big fan of just put it on every day. It can be your moisturizer if you don't have very dry skin, and it will just
Mhm.
help protect you from UV rays that you don't even realize you're getting exposure to.
Yes, makes sense. How important is it to choose more natural products versus the standard products? When you walk in, I've read the labels on some, and I'm like, I can't even pronounce half of what's in there. And then, of course, in recent years, you find more coconut oil based and slightly more natural options. What would you recommend?
Yeah, well, so this is something that I actually just did a podcast recording on it. Um, I don't think that just because something is natural means it's better. Now,
Mm,
I totally
mm,
get the concept of like, I want natural. I want it to be good for the environment. I don't want animals harmed. I want, as pure as possible, right? But the issue is, just because something says natural doesn't mean it's better. And in
yeah.
fact, one of the most irritating things to your skin is actually essential oils and botanicals, right? Which sounds like, I mean, totally natural, right? Like, smells good, and they're flowers and extracts. Like, how could that hurt your skin? But they're one of the most common irritants in products. So I really actually recommend you stay away from those. So avoid fragrances, avoid essential oils. Those things can be really irritating to the skin. Your skin doesn't really need that. So I know sometimes it can be scary to see some of the product names, and they're complicated. But I'll tell you, if you were to like look at the breakdown of like a blueberry by its structures, those would also be complicated names, right? So life is chemistry, and just because you can't pronounce a word doesn't mean it's bad. And rosemary oil is not necessarily better, or lavender. In fact, these are huge allergens that are on the rise because these brands are putting, because it sounds appealing, right? Natural botanicals and essential oils, and it sounds really appealing, but it's actually not the best for your skin. So I recommend, I mean, I get most of my skincare from the drugstore, so I don't spend a lot of money on my products, but I go with companies that are really well known, and they have dermatologists
Mm,
helping create the formulas. They're fragrance free, and so I would say, just because it's, CeraVe or Neutrogena or these like big labels, it doesn't mean that they're not good. In fact, I would argue they've spent the money in research and clinical trials and development to make sure that these products are safe and good. And unfortunately, the trap of clean beauty too, again, that's just a marketing ploy. It doesn't really mean anything. It doesn't mean that the products are safer. It doesn't really even mean that they're better for the environment or better for you. So what's more important is just
mhm.
sticking with, I would say, if you have a dermatologist, like, ask them what they recommend. And I tend to stick with the companies like La Roche-Posay, CeraVe, Cetaphil, Neutrogena, those kind of companies. And it's not necessarily fancy or sexy, but they're really good. They're non-irritating, and that's probably your best bet.
Makes a lot of sense. Personally, as a lifelong surfer, I, I of course, I'm very aware of what happens to my skin, especially if I've been on a surf trip to somewhere like Fiji, where the ozone is slightly thinner and you're exposed to very harsh sunlight. My skin is quite a mess by the time I get back, and it takes a while to recover from that. And natural sunscreens were the worst. That's what I found in my own
Yeah.
experience. Like coconut oil based stuff, it just comes off. Whereas if
Yeah.
you get a really good zinc or something containing zinc oxide, you tend to be better protected. So that's something from my own experience that I've found.
Y-
Well, what's your perspectives
Right.
on sunscreen and zincs?
Yeah, well, so there's some debate. I mean, not really a debate for me as a dermatologist, but chemical versus the physical sunscreens. And so zinc and titanium, those are examples of physical sunscreens.
Yeah.
And some people prefer those because there was a study a few years back that showed when people put on, really like their whole body, they covered it with chemical sunscreens. Some of those chemicals were, when they drew their blood, they did find them in the bloodstream. Now, the study
Mhm.
did not say that that was causing any harm or any problems. They just noted that it was absorbed in your bloodstream. And so we know that the skin absorbs stuff, right? Like we know that.
Of course. Mm.
So some people don't feel comfortable knowing that it is being absorbed. So if that is you, don't, say no to all sunscreens. Stick with a physical sunscreen like zinc. Or zinc oxide or
Mm.
titanium dioxide. And then the other part of sun protection that people, it's sunscreen is just one component. So I would also say, like sun protection's up here, sunscreen's one of them, but also I love like rash guards and hats and sit
Yeah.
in the shade, just like making lifestyle choices like that instead of sitting out directly on the beach, like sit under an awning or a cabana. When you go walk your dog outside or take your kids to the playground, take a hat, right? Or I have like this like
Mm.
little UPF shawl that I'll just carry because it's hot outside. So I don't want to wear, a jacket, but I can just like drape it over my shoulders just so I'm not in the direct sun. So just making smart choices like that can be really helpful as well.
Yeah, for sure. That's something, a habit I built up from growing up in South Africa is wearing a hat. And I think
Yeah.
that has really helped me make up for the fact that I do spend a lot of time in the ocean. And actually, in recent years, I found a surf hat that is just amazing by a company called Kaola from Portugal. And it doesn't come off even in big surf. And it makes a huge difference because you're
Yeah.
just not getting that harsh exposure on an ongoing basis. So physical barriers like that are super important. Wetsuits, rash guards.
I feel like nowadays they are making super breathable. It wicks away the sweat. If anything, I'm cooler
Yeah.
wearing those things because it dries the sweat than I am wearing a cotton t-shirt or cotton clothing or polyester, right?
Hmm. Do you get anyone asking about vitamin D? Like, shouldn't we expose part of our skin to the sun in order to elevate our vitamin D? And what are your thoughts around that?
Yeah, yeah. I do hear this a lot, and actually, well, I'm laughing. Just I like how you say it. We vitamin D. It sounds fancier when you say it. So, there
Uh,
have been so I do get this a lot because people will use that as an excuse. Well, I don't wear sunscreen every day because I need my vitamin D. It is true
mm,
you do synthesize vitamin D in your skin through UVB wavelengths. So this is the wavelengths that don't go through glass and windows. So if you're sitting in your car and you feel the sun coming in, you're not going to be synthesizing vitamin D. But they have done studies that show that there is really no difference in vitamin D levels between sunscreen wearers and people who don't wear sunscreen. And some of the theories behind this are nobody, not even me, we're not putting on enough sunscreen. We just don't do it, right? Like you really need a whole shot glass to cover your body, two fingers to cover your face. And I'll tell you, most people aren't putting it on that thickly, or it sweats off and they're not reapplying and they're not putting it on all the skin that's exposed. So most people are still getting some sun exposure, even when they wear sunscreen. Um, and the other thing is, as we age, we our skin is less able to produce vitamin D in our skin anyways. And if you have darker skin. And so the people who are really most at risk are going to be older people, darker skin types, or who live in areas where there's not a lot of sun, especially during like the winter months. So vitamin D deficiency is a problem. I know it is, at least here in the US, for a lot of people, and depending on where you live and your skin type. So what I recommend is just get your vitamin D levels checked. It's really easy. They can add it onto your blood work. And I would say a lot of people need vitamin D supplementation. We just don't eat enough. There's not enough vitamin D in foods either for us to get it. So a lot of people just need to supplement. Anyways, but studies have shown whether you wear sunscreen or not, people still had like low vitamin D levels. So a safer way, a better way is to just check your levels and supplement if you need to.
Makes a lot of sense. I've heard you talk about grateful aging as well as graceful aging. What does it mean?
I'm trying to convince myself of that. But yeah, so we do hear the term graceful aging, and I would say like, yeah, I want to age gracefully. I want to look like myself, the best version of myself, but I don't want to be obsessed with stamping out every sign of aging or always unhappy with myself as I age because I don't look like I did when I was 25 and feeling down about it and like, so I think we need to like reframe what it means to age. Like it's okay to not look like you were when you're 25. And this is I feel like more of a problem for women than men. Like women are sort of expected to stay frozen, under 30 years old. And, we have kids, but yet we're supposed to still have the same bodies we had before we had kids. And we're supposed to, not have any wrinkles. And so I think we need to kind of get away from this unrealistic beauty standard that we've put on people and instead, age gracefully, where try to be the best version you can be. Try to do, like, I want to be super proactive with my health, including my skin. And I want to do a lot of maintenance, right? So I know the things that can help keep my skin youthful. I do some cosmetic procedures, but again, I still want to look like myself. I don't want to be 60 and yes, have no wrinkles or loose skin, but look alien like, right? Like that's not my goal. So
Yeah.
I find a lot of people want that. They want to age gracefully. They still want to look beautiful, but that may look and will look different from when they were 25 or 30. And then the other thing that I talk about with reframing aging is grateful aging, right? Like so often we think of aging, it's all negative. It's all like anti-aging, reverse the clock, like stamp it out. So I'm not saying everything about getting older is good or desirable, right? But I mean, what's the trade-off, right? If we're not getting older. So I think we do need to reframe what it means to be older. And as people are living longer and they're living more healthy lives, right? Like I have friends in their 60s who are in amazing shape and they don't, look 60, right? Like in our idea what 60 should look like. So I think we'll see more of that too, is our chronological age, which is like our birth, based on our birth year, is not always going to match our genetic age. Our genetic age may in fact be significantly younger. So yeah, I think it's two parts, right? Like graceful aging, just trying to be the best version of yourself for as long as possible, but still yourself. And then also just an appreciation for life and different seasons, and that things are going to change. It doesn't mean it's bad. And just trying to see the positive in each season of life that we encounter.
Mm, that's such great advice. And remembering that in 10 years' time, you'll look back at you today, the you of today that you're perhaps critical of, and you'll go, wow, how beautiful I was 10 years ago.
Oh my gosh, Brad, I'm so glad you brought that up. And it's not just me that does that, right? Yeah, like I'll look back at pictures when I first started in my practice or first had my kids. And I'm like, why did I think I was ugly and, looked terrible and everything? Because now I look at that picture, I'm like, you looked amazing. You looked great. And now, I see pictures now and you're right. Like in 10 years, I'll look back and think, oh, wow, that, you look great. Why was I so hard on myself? Yeah. We need to appreciate ourselves in the moment when we are, right? Because yeah, we always look back and think, Gosh, I wish I didn't see what I see now. So that's a great point.
Any other tips for the aging process? What are your thoughts about interventions such as Botox and other ways of kind of like freezing the skin at a point in time so that you don't create new wrinkles and creases?
Yeah, well, so cosmetics, I feel like this can be sort of controversial for people, and sometimes people think it's like very binary, like it's all or nothing. You either are like all into
Yeah,
it and you're gonna look crazy, or you're so like against everything and you won't touch it. And but really, I find most people are somewhere in the middle, and I find people what people really want is they want their outside to reflect how they feel on the inside. And if they're feeling, they may be 50, but they feel youthful. They work out, they eat well and everything. And they look in the mirror though, and they don't see that reflected back. You know, that's the perfect person to come see me because they've already done the work for on the inside. And again, we're just doing that last little 5-10% so that when they look in the mirror, they see their inner vitality reflective. So, I mean, it's all super, super personal. And I would just say for anyone thinking about cosmetics or aesthetics, like it can be done in a very natural way. It doesn't have to be over the top cartoon like. um, are there people who take it too far? Absolutely. But it can, really the best cosmetic procedures are things where no one really knows you had anything done. No one asks you, did you have
yeah.
something done? Right. They just think, oh my gosh, you look really great. That dress looks great on you. That color looks amazing. Or did you just get back from a trip? You look so well rested, right? Like that's the goal. So I find when you're already doing the work on the inside, you've got a healthy mindset. You know that we're not trying to take you back to what you look like at 25. We're just trying to make you look as amazing as possible right now. Those are the people who get the best results and they're the happiest. And it's the people who have kind of these unrealistic expectations. They're desperately trying to return to their youth. I find no matter what you do, they're never happy. They're never satisfied. They can never look in the mirror and actually see how beautiful they really are. And that's unfortunate. But yeah, it can be done really well there. It is true. I believe that if you do get a little bit of Botox or you do what I say, little tweaks along the way, with maintenance, you can stave off needing to do much bigger procedures when you're older. So, prevention is key, then maintenance. And then if you're ready for it, some kind of rejuvenation can be helpful.
Just out of pure interest, so if someone wanted to look at having some cosmetic tweaks along the way, so say someone's 50 and they've noticed, some sagging or whatever it might be, what might those tweaks be? Is it, yeah, just out of pure interest, what might be some common tweaks that can help you rejuvenate? And I say this having looked at people like you see Brad Pitt over the years, and he's obviously doing something, but it's subtle.
Yeah.
You never look at him
Yeah.
and go, wow, you look alien. It's really
Right.
subtle and he's aging, but it looks good. He is Brad Pitt.
I mean, right. Like when you start off like
Yeah.
that, with a great
Yeah.
canvas, that does help. But yeah, I mean, they're definitely actors like him. Let's see who else would I say? Like Tom Cruise, right? He doesn't seem to age.
Yeah.
Um,
No.
and then right, and
Yeah.
then they're actors where you're like, ooh, like they don't look anything like they did. They've gone too far.
Yeah.
And so yeah, like
Mm.
you want to be the Brad Pitt, right? But so what would be some of the tweaks? Well, it really depends on what bothers the person. So usually when they come in, I want to hear, like I can look at them and kind of assess what I think, but I first want to hear what they say because it doesn't always match. Sometimes what they're really bothered by, um, isn't really what I see or what and then we'll talk about it. But I would say the first thing for people is to even out your complexion. So as we get older, especially if you spend a lot of time outdoors, you may notice you're getting discoloration of your skin. Maybe it's kind of splotchy. Maybe you've got some dark spots or sunspots on it. And so I find before tackling things like wrinkles and skin laxity and all these other things, if you can just make your skin complexion more uniform and even, that takes like years off. It makes such a big difference just to have that uniform complexion. So I usually like to start there. Um, start them on just making sure they're on a good skincare regimen at home. Again, it doesn't have to be fancy. I might throw in like a vitamin C serum in the morning for them and a vitamin A cream at night. That's my regimen personally. But talking about doing things like I do chemical peels, like doing a chemical peel, or some people might do like a laser resurfacing procedure. Like I find those can be a great starting point. It's kind of cleaning up the canvas, removing that sun damage, helping remove fine lines and wrinkles, and just brightens the skin. And when your skin is bright and vibrant, it makes everything look better. So that's usually where I start, just depending. And then if they feel like they need some volume, we might talk about doing biostimulants or fillers, or I find Botox, just a small amount of Botox does brighten the skin up. It's really unbelievable, where, the goal is, at least for me, is to still have some movement where you can still emote, but that you just have that sort of bright, glowy look. It's really nice. And you still look normal. You still look like yourself. So those are kind of where I start. It's just kind of evening out the complexion, making sure, that the other thing is, if you're smoking, if you're drinking excessively, if you're getting a lot of sun, I'll usually tell people, don't waste your money, right? Like, I can do this for you, but you're not going to get the results you want. And you really are just wasting your money. So if you're not going to commit to doing those other things, or eating better, eating less sugar, then you are kind of, throwing money out the window. So it's important to make sure you're doing those other things as well.
Great advice. Yeah. So for someone like myself who is probably not going to stop surfing, I enjoy it. I mean, at some point, I'm sure it'll slow down. I find that my freckles do darken in summer, especially living in a place like New Zealand. The sun is quite harsh, even with a hat, even just from reflection
Yeah.
off the water, even with a layer of zinc.
Yeah.
So there's probably no point worrying about that kind of thing. But obviously the lifestyle side is really important for now. And maybe at some point in the future, the evening the complexion. I must say, during winter, the freckles fade, and maybe that's fine because they're not, it doesn't bother me. I've had them since I was born, I guess, 5 years old.
Yeah. I mean, that's the thing, right? They have to bother you too. So if it doesn't bother you, then you don't have to worry about. One thing you may want to consider, since you are outside so much in the sun, is there's a fern extract. Have you heard of Polypodium leucotomos? Do you guys have that?
Not at all.
In New Zealand, but it's a fern extract that has been shown that people recommend it, and I've started recommending it in the summer, or when people who have very active lifestyles and they are out, that they take it. It's either a pill or a gummy, and you can take it to help fight some of the free radicals from sun damage. So it can help. It's not a replacement for sunscreen, but again, it's for people who are outdoors, very active lifestyle, and they're exposed to the sun. So that could be an option for people if it's available in your area. One of the companies called HelioCare, or another one is called like Inner Glow, but those are two companies. So something to think about too. And it's natural. That one's natural. You guys will, and I approve it.
I like that a lot. So it's a fern extract. Well, we have a lot of forests here with many, many ferns, so I'm sure we'll find that. That's a great option. What about other supplements that people may take? Because there's a lot of talk. If you walk into a local grocery store, there are just shelves and shelves of supplements claiming to give you great skin, collagen, this, that. Is any of it worthwhile?
Well, it may be actually. So I really am not a huge supplement person, but I did get my vitamin D levels checked because I broke a bone and I was slow to heal and I was low. And so I do find that checking your vitamin D levels and supplementing can be helpful. And studies show that taking vitamin D3 with K2, so potassium 2, can help the calcium that you ingest and the calcium in your bloodstreams go to your bone and not other organs. So that is something I take. I take a multivitamin just because I think just in general that's good to take. Specifically for skin, there have been some studies out of Australia that have talked about the role of nicotinamide, which is a B3 vitamin. And in their studies, taking high doses of it, which was 500 milligrams twice a day, did reduce the number of skin cancers that people had. And this study, it was done in people who had, I believe, at least 2 skin cancers or more. So the question is whether someone who's never had a skin cancer, should they really be taking it? That those studies haven't been done that I'm aware of. But again, it's relatively safe water soluble vitamin. So I wonder in years to come if I'll be recommending that, just like I did the polypodium leukotomos. But certainly, if you've had skin cancer and you're wondering like, what else can I do? I wear hats. I seek shade. You know, a lot of times I find my patients will say, the damage is done. Like, what can I do? They sometimes feel helpless. That I'll say, well, let's try taking, nicotinamide and see if that helps. So there have been some good studies showing that that can reduce the number of skin cancers that people have. So that might be something. Biotin's really been debunked for hair growth. So I would just caution people to not be taking biotin, especially high doses of biotin, because it can actually mess up some blood work with your thyroid or if you're having a heart attack. So wouldn't really recommend that one. Collagen, that's like a big one. And that is something I recently started taking, more like out of curiosity to see if I notice a difference. But there have been some studies showing that taking the hydrolyzed collagen can be helpful in making your skin dermis thicker, looking more hydrated, fewer lines and wrinkles. So I think we'll be hearing more about that. The thing with supplements, they're, at least in the US, they're not regulated. And so it's a little bit buyer beware. They really can put whatever they want on the bottle, and they don't have to be necessarily held accountable to it. So if you are going to be getting a supplement, I would seek a reputable company. If they have a third party verification system, that can be helpful. That means another company took their product and tested it to make sure it has what they're saying is in it. So it seems like everyone's recommending supplements. They're all over. It's hard to know what to pick or what to choose. But if you have a history of skin cancer, taking nicotinamide might be an option. Of course, talk to your doctor. I'm not anyone's personal doctor here on the podcast, but vitamin D is something I'm personally taking in collagen, and those have been shown. There actually are studies showing that can help improve your skin appearance.
I've been taking niacinamide, which is a version of nicotinamide, I believe.
Yeah,
and
it is
without flushing. And I've found that it's been pretty good. I mean, it's hard because, and this is something that people would perhaps not realize, but the changes are not instant. It takes a long time to see some kind of change. So maybe, what would you recommend? Take a photograph of yourself and check in a few months later, because you're not going to see results in a few days generally.
Yeah, that's a great idea. It's like weight loss, right? Like you feel like, is this working? I've been doing this, I'm not seeing the results. And that is one big problem with skin care, is that people give up too quickly, or they're not consistent, and they'll bounce around and try different things. So try to refrain from doing that. The skin, it's not overnight. There are no quick fixes really with anything. So it depends on what we're treating and what we're doing. Like if you're on medication for your acne, you should see results in about 6 weeks, but they'll get better and better. If you're starting something like a collagen or tretinoin or doing biostimulants, like that requires your own body to build its own collagen. So I usually say give it about 3 months. Hair loss and hair regrowth, 3 to 6 months. So these things take time. Don't get discouraged. Stick with it. And if you picked the right products, like things that actually can help your skin, you will reap the benefits. I'm curious to know, what do you take of your niacinamide? How many milligrams?
500.
Okay, so that's what I'm talking about. You are taking that. Do you take it twice a day?
Yeah. Take it once a day in the morning generally.
Once a day. Okay. Yeah, so that's exactly what I was talking about. Niacinamide, nicotinamide, they same name. Just make sure the niacin is the one that will cause flushing, and they work work for totally different things. So you don't want to take that. But I think for people with active lifestyles, especially if you've had a history of skin cancer, that can be helpful.
I did have a basal cell carcinoma removed from my face many, many years ago. And that's when I first started really paying attention to this. I
Right.
also found, and I know many people suffer from forms of psoriasis or eczema. So I wanted to ask you, it can be quite confusing. I was prescribed a cortisone cream, which did
Hmm.
help. But it turned out after trying all kinds of elimination diets that it was really stress that caused the flare ups. And it took me a long time to realize that how we think can be reflected on our skin. Is this something that you
Yeah.
found in your practice, and any tips for people to deal with annoying conditions like psoriasis, eczema, and so forth?
Oh yeah. Well, I think we're learning so much about the gut skin axis, but also the gut
Yeah,
skin brain axis. Like this is all connected, and from just like getting into personal development personally, I've learned like how we think in our mind is
yeah,
so powerful. I mean, it is like the most powerful thing, right? It can reframe everything in our life and our health and wellness and wealth and relationships and everything. So, yeah, definitely don't discredit the power of the thoughts that you have, the things that you think, what you tell yourself every day. And usually those are negative emotions. And that creates stress in your body. It increases inflammation, increases cortisol levels, right? And that's what
yeah,
stress does. It increases cortisol in our bodies, puts us in that fight or flight state, which is fine if you're running from a tiger back in the days, or you've
yeah,
got a deadline on a test, or you're competing in something, right? But we're not meant to live at those high cortisol levels, fight or
yeah,
flight levels, right? And that's how in our modern society, so many of us live. Everything is urgent, 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 and we're doing 1,000 different things. And so, yeah, stress absolutely can play a huge role in everything, but in skin conditions for sure. Don't discredit that. It can make your acne worse. It can make you lose your hair. It can really be a trigger for so many things. So again, why skincare is whole body care, right? And your mind is part of your
mm,
body. So taking the time to do activities that help relieve your stress, like surfing probably does that for you, or yeah, I
it
love
does.
to do yoga or be in nature, turn
Yeah,
off, like cut off from technology a little bit. Don't always be checking your emails and getting that dopamine rush and then reading a bad email and getting all stressed out. So yeah, I mean, absolutely. We're learning more and more. And I think we'll continue to hear about this, that the skin brain axis and how we think affects our skin and all of that. So important, and still a lot of work we need to do. But yeah, don't discredit the power of the thoughts you have and your lifestyle and the stress in your life.
absolutely. Uh, Lifestyle and nutrition, any tips for our audience who love these kinds of things? You mentioned reducing sugar, moving, time in nature. Anything else that people should consider building into their day-to-day routine? What are some healthy habits?
Yeah, well, so yeah, I've really been into this recently when I learned that eating too much sugar can form these things called advanced glycation in products. So the sugar binds to our collagen and makes it very like brittle, and it breaks and it's no longer supple. And so, think about like sugars in so much of what we eat and so much processed food. There's all this added sugar we don't even realize. So, and I mean, I've got a sweet tooth too, so I'm by no means saying no sugar, but just be cognizant of it and look at the
Yeah,
packaging, because that really impacts your whole health, but it also is reflected in your skin too. Alcohol, like we used to think, oh, having a glass of wine a night or two for men was healthy. Red wine was healthy, and I enjoy red wine, but what I've learned is that um, probably doing it every night isn't really as healthy as we once thought it was. And so just being mindful about how much alcohol you're having. Alcohol also affects our sleep. And so you don't get as restful a night of sleep. And then you wake up and you don't feel as good. And your skin does reflect that. Anyone who's had a newborn or pulled all-nighters, right? You don't look your best when you wake up. Sleep
Yeah.
is a big one. That's something like when you're in I feel like your 20s and 30s and you're just like, go, go, go. Like I felt like sleep was sort of like, I was almost proud of how little sleep I would get and I could
Yeah.
still function. And now I realize in my 40s, I'm like, that's not really something to be proud of. In fact, getting good sleep helps everything. So trying to get between 6 to 8 hours, I find like my number's 7. That's like my ideal number. So, getting sleep can really help not just your skin, but your whole body as well. Weight training. This is something that has been come out in the last few years, that weight training more so than cardio, while both are good, can actually improve the appearance of fine lines and wrinkles. And we know, especially for women as they go through menopause and midlife, but really everyone benefits from weight training. So I think we'll see a push for more women 40 plus to be lifting weights. That fear of getting bulky and looking like bodybuilders is not the case, but that it's important not just for our bones and muscles, but actually can help with our skin as well. So those are just some tips too.
That's wonderful. Thank you. I really like the holistic approach. And as you say, sleep is just critical. I noticed now if and I'm pretty regimented about it. I mean, I teach sleep in workshops as part of our training program at the Resilience Institute. And it's foundational. If I get 7 hours of sleep, the day is going to be a good one. Now I really feel it. 5 hours it's going to be a
Right.
struggle. It's going to,
Yeah.
So create those rhythms that will enable you to be the best version of yourself each day, and that will have the side effect will be great looking skin if you
There you go.
take if you take control of that aspect of your life. How can people connect with you, find out more, follow your work?
Yeah, well, this has been a lot of fun, Brad. They can definitely check out my podcast, The Skin Reel, on all the platforms, Apple, Spotify. My website's theskinreel.com. And for anyone listening who is wondering, well, how do I personally create healthy habits? What do I need to do to get good skin, to get healthy skin? Then I have a little PDF that I can send to everyone. It's if you go to theskinreel.com/habits, and I will send that to you. And it just teaches how I pair. I tell people you pair your skin needs with the goals, like your cosmetic aesthetic goals, and then that's how you get your habits. And it's going to be different for everyone. So if interested, check it out there. And on all social media platforms, I'm at Dr. Mina Skin.
Excellent. Thank you so much. It's been really informative. I've learned a lot, and I'm sure our audience will too. Everyone, please do check out the links in the show notes. Any final thoughts for our listeners who stuck with us all the way to the end?
Yeah, well, congratulations. I hope you learned something. But yeah, I would just say that skincare, it can be simple. It should be simple. It doesn't need to be complicated. Follow the advice of trusted resources, not celebrities. Don't follow trends. Find your skincare regimen that works for you and stick with it. And also, of course, take care of your body and mind.
Dr. Mina, thank you so much. It's been a real pleasure. And thank you all for tuning into another episode. We'll see you next time.